All right, welcome back. Another 3-minute trial summary. This trial, RSV pre-fusion F protein vaccine in older adults. Stay tuned to the end where I talk about how this will undoubtedly change my practice. My name is Mike Freilich. I'm a clinician scientist. I work in Toronto and Sault Ste. Marie. So when I'm trying to understand what on earth was a study all about, I usually start with the PICOT framework. So in this study, they included adults 60 years of age or older, so that was a population. The intervention was the RSV pre-fusion F protein vaccine. The comparator was placebo. The outcome was RSV-related lower respiratory tract infection or disease. And this was assessed on average nearly 7 months after the time of randomization. When I'm trying to get a sense of sort of the quality and the components of the study, I use the PHOBIA mnemonic, which I just kind of made up. P stands for placebo-controlled. So this study, yes, that's extremely impressive and helps to prevent confounding and time-varying confounding to really minimize bias. How is it funded by industry? Was the outcome clinically relevant? I'd argue yes. Was it blinded? Yes. And was it intention to treat? Yes. And then finally, a lot of centers are multi-center, absolutely. So in this study, there were 25,000 eligible patients. They randomized just under 25,000, quite impressive. Loss to follow-up was rare. In general, average age was 70, and approximately half of the patients were women. What did they find for their primary outcome? You can see how striking this is, okay? The cumulative incidence of RSV-related lower respiratory tract infection was markedly lower for those who got RSV vaccine compared to the placebo, an 82% reduction. This is incredible. In terms of some secondary outcomes, they looked at the efficacy against RSV-related acute resp infection and saw a lower risk against other types that were severe, lower risk. So overall, secondary outcomes aligning with the primary outcomes. There are, of course, limitations to this study. A relatively small proportion of participants who are over the age of 80 or frail, which makes me wonder how well will it generalize to that patient population. And of course, with any randomized trial, it's hard to detect rare side effects. You need real-world data for that. Overall, this vaccine was clearly effective for preventing lower respiratory tract disease. This is completely practice-changing. I can't wait till this vaccine is available, because certainly for older adults who I look after, I will really advocate that they get this vaccine. I look after lots of patients who get hospitalized with RSV, and they can be quite sick. So definitely practice-changing, and thank you to Natasha Verhoef for producing this video.